After the wonderful webinar at the end of 2018, we did together with Shanta Dube, we continue today with the effect of childhood adversity, but also paying more attention to resiliency and healing and promoting self-care activities. So, Shanta, the floor is yours.
Thank you so much, Anna, and Happy New Year to everyone. It's a pleasure to be back. The title of the presentation on the webinar today is Childhood Adversity, Resiliency and Healing, Promoting Self-Care. So we want to today recap some of what we talked about in the previous webinar. So I'm going to recap the ACE study and then talk a little bit about how we promote resiliency and healing. And then I'd also like to, through this webinar, actually run through some experiential activities that you all can participate with. And it's specifically, the purpose of doing experiential activities is to specifically help guide what we mean when we say self-care and what it means to build our resiliency and promote our healing. So going over the science of the adverse childhood experiences study, recapping, this was a collaboration between the U.S. Centers for Disease Control and Kaiser Permanente in San Diego. The study took place between 1995 to 1997, and it included 17,000 adult Kaiser Permanente members. It was one of the largest epidemiological investigations to examine the contribution of early childhood trauma to health across the lifespan. If you recall, in the ACE study, there were 10 experiences that were assessed, and these experiences would have occurred before age 18. These were adults who retrospectively responded. And so we looked at 3 forms of abuse, 2 forms of neglect. We looked at 5 exposures in the home where respondents grew up: parental separation or divorce, witnessing domestic violence, living in the home with substance abuse, living in a home where persons had untreated mental illness, criminal activity in the home, or the absence of a family member due to incarceration. And if you recall, we also discussed some aspects around these exposures. One, that they're often unrecognized or unsubstantiated. And when we say unsubstantiated, what we mean is that they don't necessarily come to full light with officials or with physicians. They often go unrecognized and unvalidated. And this can lead to the stigma and secrecy of these exposures. And most importantly, that the impact occurs early on to the developing child in ways that cannot be readily seen. So unlike, for example, if a child is taken to the doctor, they can do a quick strep test to see if the child has strep throat, or even look in the throat and see if the throat is inflamed and has characteristics of strep. With these types of adversities, we don't readily see how the endogenous stress response is actually creating problems within the developing child. And just briefly to recap the prevalence of individual adversities. Oh, I'm so sorry. We found that physical abuse was the most commonly reported. 1 in 5 reported sexual abuse, and about 1 in 4 reported substance abuse in the home. I do want to turn your attention to the exposure of witnessing mom being battered or witnessing the maternal figure being battered. That is a measure of domestic violence or witnessing domestic violence, but you'll note that the prevalence during that time was 12.7. For a couple of reasons. The way it was measured specifically focused on a unidirectional domestic violence. It didn't include partner to partner violence or domestic violence between different family members in the home. So I just wanted to point that out, because we're beginning to really recognize the whole aspect around childhood domestic violence and what a hidden problem that is. And that includes witnessing any kind of violence while growing up. And then we also created this ACE score to look at the total number of adversities respondents experienced. And, you know, it's a blunt instrument because it doesn't take into account intensity or frequency. It's really meant for us to understand, one, just how interrelated these experiences are and that you can't really look at them individually. And two, it gave us a tool, if you will, an instrument by which to look at relationships between the number of ACEs and outcomes, health outcomes, and see if there was any kind of dose-response relationship, which we did observe throughout all of our research on the ACE study. We also report that close to 2/3 of adults report at least one adversity. So, as you will recall, in the previous webinar, we specifically discussed the contribution of ACEs to autoimmunity. But I want to just draw our attention to the fact that we know that ACEs impact multiple outcomes across the life course and across generations. So starting in childhood, we examined what kinds of exposures kids are subject to. And the ACE study brought our attention to the fact that these types of early life exposures lead to the early initiation of risk behaviors in adolescence, and then subsequently the continued risk behaviors into adulthood, but in addition, multiple health outcomes. So the list here, which includes also autoimmune diseases, is meant to really stress the point that ACEs have a long-term impact on multiple social, behavioral, and health outcomes throughout the lifespan. We saw direct relationships between ACEs and the adult outcomes. And most importantly, what we understood better from the ACE study is just how these types of early life exposures have an intergenerational component. That is, if you look at this chart, the early life adversities lead to outcomes that are ACEs themselves in the adults. And so those adults that have these outcomes, such as alcohol abuse, if there are children in their environment, perhaps those children are also exposed to the same adversities. So it becomes a cycle, if you will. And this is a cycle we really want to try to break, and hence is one of the main reasons for this webinar today, is to really understand what is one pathway to break this cycle. I also draw our attention to one of the findings from the ACE study that looked at the ACE score, or the total number of childhood adversities, in relation to adults reporting their current level of perceived stress. And as you can see, as the ACE score increased from 0 is the dark purple and 4 or more is the light purple, we see that the probability, or the percent of adults reporting high level of perceived stress, increased in a dose response manner. And again, one of the reasons to really emphasize this is how early life adversity can impact not just health outcomes, but our ability to understand stress and perceive stress around us, because we know stress is actually a huge factor in our health and well-being. I think we all know that pretty well, and we're going to talk a little bit more about how that is and the ways we can help ourselves heal from those stressors. So to summarize, ACEs, stress and biology, early in the lifespan or during childhood, it's related to that unseen impact of the childhood adversity, or the unrecognized or invalidated. There's shame and secrecy behind these types of experiences, which make that a stressor on top. So it's not only the experiences that individuals encounter, but then some of the shame and secrecy behind those experiences creates a stressor, because individuals can't talk about it openly. All of these stressors early in childhood can impact learning, insecure attachment, and also lead to behavioral, physical illness, and mental illness. And we saw in adolescence that it increases the risk for behavioral health risks, such as alcohol initiation and illicit drug initiation. The research since the ACE study has also shown that these types of adversities are associated with truancy, which is skipping school, and dropping out, actually. And why is this important? Because I think we all are aware of the social determinants of health and how education is one of the leading social determinants of health. So if ACEs impact adolescents' ability to complete school, then ACEs are a strong risk factor for education as a social determinant of health. And then in adults, we have seen through the ACE study, through the findings of the ACE study, that it increases, hypervigilance in terms of perceived stress. We also know that there's the activation of the sympathetic nervous system response over long periods of time. And so in adulthood, that early life adversity can have a negative impact on the ability to manage and face stress, which can then impact our health and well-being. So how does this all get conceptualized? Well, I want to introduce the neurosequential model. This is actually something that has been extensively written about by Dr. Bruce Perry. He's a psychiatrist and has done extensive amount of research and work around understanding the impact of childhood trauma, as well as understanding ways to help children become resilient and heal from trauma. So if you take a look at this neurosequential model, it's diagramming 4 parts of the brain: the brainstem, the cerebellum, the limbic system, and the cortex. And each of these each of these segments of the brain, if you will, has a specific function. If you look all the way to the right, the brainstem is responsible for blood pressure, heart rate, sleep. The cerebellum is responsible for sleep, appetite, arousal. The limbic system is responsible for emotional reactivity or regulation, attachment. And the cortex is actually related to our ability to think concretely and abstractly, as well as higher order decision making. So what Dr. Perry has really presented is a good way to understand how trauma and stress can impact using this, if you will, bottom-up approach. It's the brainstem where the core symptoms of trauma really reside, in a sense. And what I mean by reside is it's where it has a very strong impact. So we're going to use this neurosequential model so that we can help ourselves understand what are the best ways we can heal and recover and build our resiliency. We really need to think about healing as a paradigm shift, not because we don't have an amazing healthcare system. We do. We have a medical and healthcare system that has achieved so much over the last 100 years, yet it is a young science. And there are a lot of downsides in that it is reductionist. There's an increase in specialization, which leads to division of care. We see that especially in the United States. It also leads to high costs in healthcare, increased dependency on pharmaceuticals. And we also know that 1 in 3 patients experience adverse events during hospitalizations. So again, putting healthcare and medical care where it belongs, which is extremely advanced in terms of intervention, surgery, immunizations, but not completely equipped to necessarily help individuals healed through past trauma, because that's not what physicians, at least in the US, are taught in medical school. So that is why we really want to look at how do we promote our own resiliency, healing, and recovery. And thinking about that neurosequential model is going to help us. So through the next several slides and the rest of the presentation, I'm going to walk you through some reflective practice as part of self-study in your journey for healing. And I'm also going to introduce you to some mind-body self-care practices. This is a picture I took in India at a temple in Uttarakhand near the Himalayas. This flower, it was a very old ancient temple. This flower, it's a vinca. For those of you who are familiar with vincas, actually vincas are studied a lot in for cancer treatments. But vinca, this vinca was just growing. There was nothing else around except cement, and it was just growing through the cement. And it just struck me. It just made me realize that we can be faced with a lot of hardship around us, but we have the potential. We have the potential to grow and to become fully realized and beautiful inside and outside. So the first model I want to introduce is the salutogenic model. And I know I might have reviewed this previously, but I think it's important to review again, because a lot of my research actually is focused on adult survivors. And this model really helps understand, what have adult survivors done to adapt and learn and work through trauma. So the model suggests that humans possess an innate capacity to learn and adapt toward health and well-being. We can adapt in multiple ways. One way we can adapt is to towards negative or risk behaviors to ameliorate our negative emotions and feelings, but we can also adapt towards positive health and well-being. It's a stress-oriented concept, and so it really focuses on health resources as a way to maintain and improve movement towards not just our physical health, but also towards our emotional and our mental, our intellectual health, our social health. Health has to be seen as multidimensional, and salutogenesis allows us to see that. And then it examines positive health as outcomes of measures of subjective well-being. So we're not just looking at negative health outcomes or disease, morbidity, and mortality. With the salutogenic model, we get to examine populations that have undergone adversity and understand what has led to their positive health outcomes, what has led to their decrements in depression, what have led to the increased probability of reporting that their health is excellent. We need to understand that better if we're going to actually move towards a path of healing and recovery in this field. So the salutogenic model encompasses many, many things: healing and recovery, a sense of community connection, personal resources. There's also this whole field of resiliency and post-traumatic growth. It's a lot of research. And in my mind, salutogenesis encompasses it all. So I did 3 specific studies, or let me just say I participated and led 2 of these studies on research among survivors. The first study went back to the original ACE study, and I was very curious to understand amongst those ACE participants in the study who had 1 or more adversities, what led to their well-being. I mean, they were in the study, they lived to tell. I wanted to understand what might be some factors that contribute to their reports of positive well-being. I then repeated this study using 2010 behavioral risk factor surveillance system data, using a similar model, those who reported 1 or more adversities, and then worked with, collaborated with some folks out in the state of Oregon who implemented the Trauma Healing Project to understand the community-based participatory research work that they had done amongst trauma survivors to see and understand what helped and what hurt community trauma survivors. So this is the first study from the ACE cohort. We looked at the mean physical health component score and the mean mental health component score among trauma survivors. There were 5,000 adults who reported one or more ACEs. And the health promoting factor score, I mean, we looked at each health promoting factor separately, but for to simplify the presentation, I'm showing you the health promoting score. We looked at the health promoting score as 0, 1, 2, 3, or all 4. And the health promoting factors were physical activity and smoking abstinence, which we know are evidence-based health promoting behaviors. Emotional support and educational attainment. We looked at amongst respondents who reported high school or greater. And so this graph essentially shows that those survivors who only engaged in 0 to 1 factors had a lower mean score for physical health and mental health than those trauma survivors who engaged in all 4. So having a higher mental health component score meant better health. And then we did a similar study amongst adult survivors in the BRFSS. And these data were collected amongst 5 states in the US and looked at the same factors, looked at the similar health promoting factor score, but instead the outcome was a question asking respondents about how many days in the last 30 or in the last month were their days unhealthy mentally and physically. So this graph shows the mean number of days they reported as being mentally unhealthy or physically unhealthy, and the health promoting factor score. So as you can see, if the trauma survivors only engaged in at least 1, they reported a greater number of mentally and physically unhealthy days than trauma survivors who reported all 4. And there's a graded relationship. I found this to be striking because it's a testament to what trauma survivors can do to maintain and promote their health. You know, we talk a lot about preventing disease, but we also need to emphasize promoting health. There's no doubt that preventing ACEs will prevent disease outcomes, but ACEs are not always easy to prevent. We have to strive towards that, but we have to understand that there's a large percent of individuals that experience traumatic stress during childhood. So we've got to really, again, shift the paradigm to utilize a salutogenic model to understand how we can promote health. And then in terms of the Oregon study, we looked at healing and recovery amongst trauma survivors residing in a community in Oregon. We asked 85 of them what helped or would have helped. And overwhelmingly, they responded safe relationships, human connection, shared experiences, validation, and that their own choices and action empowering themselves is instrumental in healing. They also reported being engaged in school was important. So if you remember the graph I showed you before, we looked at educational attainment. That is a huge health promoting or salutogenic factor. And we already know that from the research around social determinants of health. But for trauma survivors, it's especially an important factor. And then they also reported movement. So not just physical activity, but other types of body work, which included yoga and mind-body practices, massage, and dance therapy. So these trauma survivors in Oregon also reported that alcohol and drugs were used to cope, which is not unusual and not surprising. We would expect that. So remember, we talked about adaptive behaviors. So there are some behaviors that might be what we call maladaptive in that they're not really conducive to one's health. And so they may lead to disease outcomes, but for the survivor, we can't judge them. Those are the behaviors that might help them adapt to the negative emotions or feelings they might be having. So with all of this and this focus on adult survivors, we developed this two-generational approach, which doesn't detract attention from the need for primary prevention amongst children and adolescents. In fact, it emphasizes it more, but it emphasizes it by recognizing that there are a large number of adults who survive their childhood adversities or childhood trauma. And so we have to think about processes of recovery and healing for the adults, mainly not just for their well-being, but also to prevent the intergenerational transmission of these types of early experiences, these ACEs. Promoting the well-being and recovery and healing of adults can be accomplished through trauma-informed interventions, through helping individuals or adults modify their risk behaviors, providing them personal resources, learning and engaging in intellectual well-being is a very important aspect to our growth. And learning doesn't necessarily mean one has to go into school and get a degree. Learning comes in different forms, and it could come through learning a new hobby, a new trade. It comes in multiple forms. Using complementary and integrative health care, and we can't forget about clinical preventive measures. We still need to keep our eye and focus on preventing disease as well as promoting health. So the trauma-informed framework developed by the Substance Abuse Mental Health Services Administration in the US, part of the Health and Human Services, it's a governmental organization. They developed this framework, which was informed by the ACE study. And it's through this framework that myself and others are really trying to promote professional development about how to be trauma-informed. Not just the why. I mean, the why of the trauma-informed is what the ACEs science has taught us, but also the how. How do we become trauma-informed? One way is we have to understand that while the ACEs study informed trauma-informed care, they're not the only forms of trauma. There's multiple different types of trauma that can occur in the lives of children. So we need to keep that lens open. But going over the 4 principles, realizing trauma is widespread, and that's about educating and building awareness, recognizing the symptoms, so understanding that behaviors of children and maybe some adults may be due to some underlying stressor or trauma. We have to accept that. That's an important piece. We have to accept that, that kids aren't bad, that there might be some root cause to their behavioral difficulties. And then responsive using key strategies. That's how we really adopt trauma-informed principles, is we adopt it by becoming aware, accepting, and then really starting the to-do. And then most importantly, self-care to enhance our own resilience and manage stress. And this is the part, unfortunately, I believe gets left out of a lot of trauma-informed trainings here in the US. I can't speak for in Europe and other parts of the world, but the self-care piece is so critical to resisting re-traumatization and being responsive. And it requires us to really engage in our own self-care, our own self-awareness, utilizing reflective learning and practice as part of adult learning theories. And for the clients that we may be working with or colleagues, understanding potentially their stressors and traumas that might be involved in their well-being. So I'm going to take a few minutes now. We're on the half hour. We're going to engage in a self-reflective writing activity. So if you would please kindly take a piece of paper and a pencil out. I'd like to facilitate this. It's a self-reflective writing activity for us to build awareness about our own reactions and responses to the environment. So the first question, what makes you feel safe and grounded? So once you think about a time where you felt safe and grounded, what was it about that time or experience that made you safe and grounded? And then thinking about that situation that you felt safe and grounded, I want you to reflect and identify what were your thoughts and actions when you felt, or when you feel safe and grounded, or when you felt safe and grounded. And what were your emotions and responses to those emotions? And this place where you felt safe, it could be during your childhood, it could be something that happened recently. The important thing is that you identify what made you feel safe and grounded. And then what are your thoughts and actions when you feel safe and grounded? Then I want you to think of a specific time when you felt safe and grounded. So just take a minute to finish that.
Yes, it's a good idea. I'm also doing it for myself.
Great. Okay, now let's go to the next column. And it might make you feel a little uncomfortable, but that's okay. It's okay to feel uncomfortable. You're in a safe space. What makes you feel unsafe and reactive? What makes you feel unsafe and reactive? It's not always just the opposite of what makes you feel safe and grounded. So just to clarify, it could be something very different from what makes you feel safe and grounded. Then similarly, when you feel unsafe and reactive, what are your thoughts and actions? What are your thoughts and actions when you feel unsafe and reactive? What is your stress response? How do you respond? Then I want you to think of a specific time when you felt unsafe and reactive. And then finally, I want you to identify how do you create safe space for yourself? What do you do to create safe space for yourself? So I want to just recap this activity. Normally when I do a live presentation of the self-reflective writing activity, or if I'm doing a training, I invite participants to share. I don't force. Whoever's open to sharing can share, because that's how we learn from each other. But the purpose of this reflective activity is not for anybody else, but for ourselves, for you, to understand and have awareness about when your autonomic nervous system starts kind of getting tweaked. What is it? What are the senses that that you're taking in that cause that uncomfortable feeling? What are the senses that you're taking in that cause you to feel safe and grounded? Because when we understand that, it helps us lead us to that healing pathway, because we can understand how to take care of ourselves.
Yeah, I have a question, Shanta.
Sure.
You're talking here about creating safe space. From my own experience, a lot of people who experience trauma in childhood, there is no safeness. There is no safe space. They cannot connect. So what is your experience when you let people do this exercise? What I've learned is to substitute this safe space with just a space where they can feel at ease.
Okay.
A little bit at ease. You know, like that's because I think it is too much probably to ask them to think of safety.
Sure. No, that makes total sense. And I think developmentally, when I do this activity, I do it mostly with adults, not children. You're right, because children aren't going to have a safe space if they're in a chaotic or an environment with a lot of ACEs. That's going to be difficult. I have adults at least try to identify what they do for themselves that creates safety or creates space where they can, start to be grounded. That might be a better way to put it. But your point is very well taken. I completely agree that not everybody can feel that safety. I know one individual who has told me that work is very unsafe. Like being at work is very unsafe for that individual.
Mm-hmm.
Meaning being in the office. So when we've talked, I'm like, well, how you got to be at work. So how can you create safety for yourself at work? Um, and so the individual has said, well, a lot of times I will shut my door with a sign on the outside, letting people know I'm here and to knock. Because what the individual has said is that the noise, that they're very hypersensitive to noise and talking, and that really distracts them. Um, Something about something that happened in high school. I don't remember it. I don't remember the whole story, but there was something that caused it to be a trigger. And so I'm saying all this because um, it's not a totally safe place because it's work and there's whatever interactions are occurring that's causing that feeling of being unsafe and ungrounded. But they still try to create that environment for themselves. Does that make sense?
Yes, yes. I saw that someone wants to share.
Oh, sure. Love to hear share.
Would you do that?
You want me to share or you want somebody else to
Now,
share?
if you open the chat,
Oh.
so you can see it as well.
Oh, okay. Let me.
Down the chat option.
Mm-hmm.
If you're going to share, the other side is the chat.
So do I stop share?
No.
I see. Oh, more. I see. Chat. Got it. Okay. I'm prepared to share if you want an example.
Yes. And I said, good so.
Okay. So am I going to read it?
Yes, let's see how it will go.
Okay. Yeah, I'm happy to share.
So let's see if we probably, okay.
So if you're going to, and the person's name is Lone.
Yolonica.
Launica. If you're going to share, what I'd like you to share first is what makes you feel safe and grounded.
A combination of factors, she wrote.
Okay.
Mm-hmm.
Does she know what the
Do you know what factor? Yeah.
Okay. Both smell, warmth, soft materials. Very good. And then what are your thoughts and actions when you feel safe and grounded? Okay. And shut my eyes and pretend that I'm being held. Okay. And what are your thoughts and actions? Oh,
Oh, this is what you do, I think, what she's
okay.
doing.
I'm sorry. So let me tell. So what makes this individual feel safe and grounded is a combination of factors, which include smell, warmth, and soft materials. The thoughts and actions are that the individual shuts their eyes and pretends to be held also. Okay, what are your emotions? Oh,
Yeah.
when I pretend this, I feel both safe and sad. Okay. Can you think of a specific time you felt safe and grounded? When I was held by someone who wasn't expecting anything from me sexually. Thank you for sharing that. Would you like to share the other side, what makes you feel unsafe and reactive? Okay. When I have the feeling that people want something from me that I cannot give them. Okay. And what are your thoughts and actions when you have this feeling of being unsafe? What is your stress response?
Yes.
I shut myself down and flee inside myself. Okay. Can you think of a specific time when you felt unsafe and reactive? Childhood and previous relationships. Okay. Thank you for sharing.
Yeah.
Do you want to share how you create safe space for yourself?
Hard work.
Yep. I hear you on that one. I'm with you. I can validate that. Do it every day. Yep. Thank you so much for sharing. I really appreciate it.
Thank you.
Uh, So I want to be aware of time. So we have 15 minutes. Um, we went over the stress response system previously. I wanted to go over it quickly again, just to recap. Remembering that there's the fight, flight, or freeze, and thinking about that neurosequential model, that's occurring in the brain stem. Okay, that's where the core trauma symptoms lie. And so remember, the autonomic nervous system is centered there too. And so stage one, we're receiving stimuli from our five senses that go to center our brainstem, and we decipher whether or not it's threatening or not. If it's threatening, then the body goes into stage 3, which means it gets activated. The autonomic nervous system, the sympathetic nervous system gets kicked in. And then when the threat's over, we go to stage 4 and our body comes to homeostasis, which is facilitated by the parasympathetic nervous system. But the problem is most of us are in stage 3 most of the time. In society, and at least in the United States, and I think it's pretty much the same worldwide, we are in stage 3 a lot, which means we need to really find ways to promote our healing and our resilience. And we do that, we can do this through specific practices using, self-care, mind-body self-care, exercise, and we're going to talk about all of this in just a few minutes. So take a look at this, little image. Stress at the center, and then we have our body, mind, behavior, and emotions. And take a look at it and see if any of these symptoms arise for you. Usually when I give this training or this talk, everyone says at least one in each of the 4 quadrants. Some people might have it in one quadrant more than another, symptoms more in one quadrant than another. But I do believe you would at least resonate with one of these symptoms. And this is our autonomic nervous system. And it's responsible for our stress response. In other words, when I say responsible, it is what creates our increased heart rate, dilates our bronchi, dilates our pupils. Our pupils get really big when we're excited. A lot of physiological responses occur just by the just by merely taking in whatever threat came in through the senses, the 5 senses, that kicks in the autonomic nervous system. And then the vagus nerve is the largest cranial nerve. It's the 10th, and it innervates all of these different organs, which also impacts our stress symptoms. So let's go back to the neurosequential model. Okay, remembering that the autonomic nervous system is in the brain stem. This is the area that we need to focus on with our resiliency. So when we talk about depression and affect symptoms, we think about psychotropic meds that help with, for example, serotonin reuptake, for example. That's the most common. Those are medication and pharmaceuticals that in their own right are very effective and needed. But when we talk about our actual trauma, our response and being trauma informed, we have to take the bull by the horns and really think about the brainstem and how to address those core trauma symptoms. So how do we do that? Through our 5 senses. Just as our 5 senses take in some negative input, we also have to build our resilience by taking in positive sensory input. That's how we utilize this neurosequential model to strengthen that brainstem, which is the core of the trauma symptoms. So early in childhood, how does the brain develop? Well, we talk about developmental plasticity. All the way in this image, all the way on the left is the neuronal connections or the synaptic connections at birth. You can see there's hardly any there. Then by 6 years, there's a whole bunch, like a lot of, because think about a child from 0 to 6, lots of stimuli, mom and dad, sisters, brothers, the environment, other kids, grandparents, the community, everything, the nature, everything. Then by 14 years, by adolescence, something called pruning occurs, and excess neurons are shed, and those that are not used get pruned off. And so what does this mean for plasticity early in the lifespan? Well, we can have adversity, but if we have factors that can promote our resiliency or protect us, such as one adult who we connect with, one positive attachment figure, or, feeling love in the environment, knowing there was one connection, that can have a huge impact on individuals who've had adversity. And then into adulthood, we talk about adaptive plasticity. Plasticity simply means that our brain has the ability to reorganize the neural pathways throughout the lifespan as a result of experiences. So we learn from our experiences, and we learn from both the positive and the negative. So it's our ability of the brain to change with learning. And so that's why healing and recovery is so important, because that process, that pathway helps in our brain plasticity as adults. So what are some of the ways we can actually promote our healing and promote our brainstem well-being, if you will? Well, deep breathing. I mean, there is no myth to breath. Pranayama, which is breathing exercises that are taught in the Ayurveda tradition in India. It's a 5,000-year-old medical system. Teaches us how to control our breath. And the reason we control our breath is through breath control, our parasympathetic nervous system is strengthened, and it builds our resiliency to when we are faced with negative circumstances. You may also have heard a friend say, or someone say, when you're stressed out, just breathe deep. It's true. Deep breathing actually impacts positively the parasympathetic nervous system, which helps to counter the sympathetic nervous system and bring our body to an equilibrium. In Ayurveda, we have something called abhyanga. We do this practice of self-massage because touch and tactile sense is very important as well. I've talked to some people I've trained, and they said warm showers are soothing, taking a hot bath. All of these things, what we can do to take care of our bodies and to self-soothe, one way is through our touch, our sensory of touch. Essential and medicated oils, we are able to do some detoxification through medicated oils, Ayurvedic medicated oils, as well as essential oils such as lavender. Lavender has been shown in scientific studies to have a calming effect. In terms of sight, that says color, it should say sight. Looking at colors, exposing our sight to the colors of nature, flowers, birds, stones, mountains, lakes, being near bodies of water. All of these sights help to calm our autonomic nervous system. And of course, sound, listening to sounds of nature, water movement, calming tones. Even some folks have done mantra. Sound is very important because it contains a frequency and a vibration that our body takes in, and that can again act on the brainstem and reduce the autonomic nervous system response. So the mechanisms for adaptive plasticity and well-being is for us to promote the resilience and health of our autonomic nervous system. We need to find positive sensory inputs. It's not just about nutrition. Nutrition is very important, but it's also what we take in. I can speak for the US society. We have a lot of social media. We have a lot of tweeting. We have a lot that gets, thrown across our phones and our computer, and it can be very overwhelming. And so we need to, as a society, find a way to break from it and give our sensory inputs positive inputs. Exercise, social support, meditation, dancing, creative activities, intellectual pursuits, all of those are personal resources that can promote our resiliency and our healing. Strengthening the autonomic response is instrumental, and we can do this through yoga and meditation. We have found that there have been studies that have shown that yoga, massage, increases something called heart rate variability, which demonstrates greater resiliency of our autonomic nervous system. I don't know if you all were aware of this story that occurred to the soccer team last summer that got trapped in a cave in Thailand. But the Thai soccer coach meditated with the boys to help them stay calm. So it wasn't about just helping them stay calm. It was working on their brainstem and their autonomic nervous system to reduce their heart rate so they weren't expending as much energy in that cave. Think about it, there were 12 of them in that cave, using up the oxygen. So the coach said, we've got to meditate and bring things down so we're not using as much oxygen and we're keeping calm. So now I want to go over this last activity with all of you. We only have about 5 minutes, so try to go through this. This is the Dube hat activity, and it's a way for you to get acquainted with yourself and understand yourself in the context of where self-care is needed. So I'd like you to take a piece of paper and a pen, and I'd like you to write down all of the different hats you wear. And the hats represent all the different roles you play in your life. So for me, I'm a mom, I'm a daughter, I'm a wife, I'm a neighbor, I'm a friend, I'm a sister, I'm a professor, instructor. I have a lot of different roles. So think about for yourself, take a few minutes, think about all the hats you wear in your life. Then after you look at, create your list of hats, look at your list. And I want you to identify 2 characteristics, 2 ways of being that you have to fulfill in each of those hats. So for example, in all of my hats, I always have to exhibit patience. So think of 2 things or 2 ways of being you have to be no matter what hat you're wearing. Then looking at the list of hats, I'd like you to identify 1 hat you love to wear, that you just love to wear. That's your favorite hat. And then looking at your list, identify the hat that's most difficult to wear. And it can be the same hat. I've had respondents say the same hat for both, and that's perfectly logical. So Anna, do you want to share your responses?
Oh, I'm not so fast, but I have some roles I place so that I'm a daughter, mother, entrepreneur, wife, therapist, a child as well. And I could not list the characteristics for all of them, but I was fast to say which I like, and which are more difficult for me, and they're not the same. So for me, most loving is, I think, to my role as a mother and and being an entrepreneur. And what I find it difficult is to be a daughter.
So now, looking at all of these hats, what I'd like you to do is I want you to imagine a hat rack in front of you. And I want you to take off all of your hats. They're not going to get thrown out. They're not going to be given away to charity. They're just sitting on the hat rack. And I just want you to take all of the hats off. And I want you to sit with that for a few minutes and see what that feels like. The hats aren't going away. They're just not on your head. They're on a hat rack. You're not wearing any hats at this time. How does that make you feel? How do you feel?
So what was interesting is that, for example, when I took them out, I realized that the roles I like are connected to real me.
Okay.
Because when I took this hats, it's like taking the things that sort of expected from me in those roles. And then I realized, but entrepreneurship, I realized that this for me, curiosity to something new, persistence, and this is what I like. It's a little bit also who I am. So it's not a hat, so much a hat.
Kind of like you. So it's interesting. I love that interpretation. Some of the trainees I've done this with will say things like, it feels horrible, or I feel lost, or it feels boring when they don't have any hats on. Some feel complete peace and freedom. So different individuals react differently to this, but the point of this activity really is when we are thinking about self-care, we really have to take off all our hats and just be present with ourselves. And, you know, not have any judgment, not have any, oh, I've got to do that. Just, and not identifying with any of the hats, just being present with oneself. That's what self-care is about. And so this is my self-care plan. I have, you know, set it up for mind, body, who's my supportive network, how am I going to nurture my spirit, what are my goals? And, you know, this is something you can pin up on your refrigerator or in your office just to remind yourself. I do want to say one thing about the supportive network. When we say supportive network, it's a network that is truly supportive. In other words, we don't name a network for namesake, for example, sister or brother, if that's not a supportive network. It has to be somebody who you know you can go to, who's not going to judge how you're feeling or invalidate how you're feeling. It's going to understand you through and through, and it's going to give you that safety net and support. That's a really important characteristic when identifying your supportive network. So I encourage all of you to utilize this map for yourselves to create your self-care plan, that you can begin on that road to healing and recovery and building your own resiliency.
And yes, Shanta, you said that you would share it with us, the slide, so we can send it to. So
I will send the slide to you, and you can distribute.
Okay, we'll distribute the slide. Thank you.
And I just want to thank everyone for your attention and for listening. And I say keep calm and practice self-care. Thank you.
Thank you, Shanta. It was wonderful to have you today. Let's see.
And I just want to acknowledge my mentor and my mentor, Dr. Ashok Murate, who I'm still on my path and journey, but he has been instrumental for me in my journey, my healing.
It's great that you're doing that.
Thank you.
Yeah, thank you. So keep practicing self-care. Keep calm.